Hello, my name is Dr. Carla Stanton. I'm family functional medicine doctor from the UK, and I'm here with the kidney coach, really collecting some testimonials, some people's journeys that they've experienced through the process of the kidney coach and Genesis. And just been having a wonderful conversation with Janice here, who's a 69-year-old retired registered nurse of 46 years, impressive, and had a family history of kidney disease. And I'll allow her to tell her story of how she came to find out she had kidney disease and the experience she's had with the kidney coach and implementing their program, but a really inspiring story. And so without any further ado, I'll hand over to you, Janice, to share your story.
Okay. Well, I was really shocked to learn that I had kidney disease. I wasn't expecting to get those lab results in when I did. And it was just very devastating because knowing what my mother went through with dialysis, and she passed away from end-stage kidney disease. And I just had never thought of myself having it until I got these routine lab results back. And it really knocked me for a loop. And I did look online to see, I just was open to seeing what I could find out, if there's anything I could do to prevent going through what my mother went through. And I did find the kidney disease solution and just read it all from cover to cover and thought, well, this is kind of empowering. Maybe there is something I can do to, stop this or to prevent going through what my mother went through, because it was just, it was a pretty terrible experience that she had. So I did try to change my diet, and that's been a gradual thing over time. And I did take the supplements and the tea, the nettle leaf tea. I've been doing that regularly, and I did see an improvement in my numbers. It was just amazing. My doctor didn't think there was anything I could do except drink more water to help my progression. But I have found that I can make a difference in using the supplements and changing my diet. And I've started to exercise at a sports and wellness facility twice a week, and that has been good. And I've also done the meditation using a respirate that affects my breathing, and that really has helped with the relaxation part of it. So I've just been encouraged that I've been able to go back to a GFR of 52, and it had been 40. So to me, that shows my kidney function is definitely improving. And that is just kind of a relief. And I just feel empowered that there's things I can do to make a difference. And it's kind of an ongoing thing. The diet part is not easy, but it is doable. And so my doctor says she's just going to keep monitoring me. And, I've been able to go off one of my blood pressure medications, but, I have to probably stay on the other one for the rest of my life. But I do feel like I'm feeling a little better. I don't have the tingling in my hands and feet that I had before I started this whole process. And so I do feel better. I don't feel quite as sluggish as I had felt. And at the time, I just thought it was because I was getting older. But I just do feel a little bit generally better all over since I started the program.
Amazing. And you said it's really been just over 2 years, hasn't it? This whole
Yes.
process, since sort of November 2019 that you first had this sort of incidental finding. And
Yes.
so, and I remember you saying to me that it's been, a gradual improvement in your numbers, in your eGFR and your creatinine and your bun. The
Yes.
numbers have gradually improved through that process.
Yes.
And so
That's
one
right.
that you feel better, and that the numbers are improving, going up by 12 points from stage 3B to 3A in that time, with the supplements and the diet and the other things that you're doing to support your health is amazing. And you also mentioned that obviously when you spoke to your doctor, you were taking something, the Celebrex, and that they weaned off that, and
Oh, yes.
the other medication, the hydrochlorothiazide, that they weaned off with the support of your doctor. So
Yes.
wonderful that you've been able to do that all for yourself. And so what have you learned, do you think, most about this process, Janice, in the last two years of 2 years plus
I
ago.
guess just that I've got a sense of hopefulness that there's something I can do. It's not an inevitable decline that, my numbers would just get worse and worse over time, but
Mm.
that there is something that I can do to help myself along. I guess I feel a little bit empowered to uh, help myself and just not listen to my doctor when she says there's nothing I can do, because I think there is a lot I can do to slow
Mm.
this thing down.
Yeah, absolutely. So the numbers don't lie. It's really great that and you're doing it. And this is what we always encourage people to do. You test the numbers. You test, don't guess, and you're watching it, and you're doing all the simple practical application, so that you can see that things are going the right direction with the support of your doctor. So thank you for hanging in there with that. What was the kind of the most challenging part of this whole process in the last couple of years for you, from an honest perspective?
I guess at first it was just devastating. I was thinking, "Oh dear, I'm going through dialysis myself here before long." But
Yes.
that was once I got over that fear,
Yeah.
and I think I just felt better. I'm not going to worry about this. I'm going to do what I can to help myself. And it was like changing my diet was a little hard, since I'm married to a husband who's a heavy meat eater, and so that's been a little hard. But I've just gradually done that, changed to eating chicken instead of beef and ham, and I guess I just don't feel as worried
Mm.
about kidney disease. The fact that I see that there's something I can do to slow it down to help myself.
Yeah, wonderful. And so, what would you say? What would be maybe some advice that you might give to somebody? Maybe they've just found out that they've been diagnosed, or maybe they're just looking for other options that might support them with their healthcare practitioner. What
I
would you
would say read the Kidney Disease Solution manual, because that just has a lot of good advice, a lot of helpfulness in it.
say?
And I would say just read that, because there is help out there.
Mm.
And that really helped me a lot. And it changed how I live, actually, because I started doing the exercise, the meditation, and the diet, and the supplements, and the tea, and all of those together really made a difference for me and helped my numbers and helped how I feel.
Wonderful. And so, you also mentioned that you've managed to switch to the Genesis supplements, the
Oh,
advanced.
yes.
And so, how's that process been? Is that
Oh, that's been great, because instead of having like 10 bottles on the counter to take one of each, it's just 2 bottles.
yeah,
And so that's just been a lot more convenient. I
simplicity?
really like that. So as soon as I finish up all the other ones that I have, I'm gonna just go with the Kygenesis because of the convenience.
Okay, well, that's wonderful to hear.
That's worked great for me.
Great. Okay. Well, thank you. Thank you so much for taking the time to commit to yourself and do this and share your story with people. I think it will really resonate with a lot of our audience. So thank you so much for taking the time
Oh,
with us.
you're very welcome.
Thank you. Have a lovely day. Take care.
Okay, you too. Thank you.
Bye.
Bye.